Hello everyone, this is Dipti Das, a student of 4th professional year, BVSC and AH, Lakhimpur College of Veterinary Science, Assam Agriculture University. In this video, I will be discussing about one of the most important metabolic diseases of horse, Azoturia. Let's start with the introduction. Azoturia is a metabolic disease. It means it results from disturbance in internal homeostasis brought about by an abnormal change in the rate of one or more critical metabolic processes. Azoturia may occur during rigorous exercise following a period of inactivity in horses. It is clinically characterized by stiff gait, hard painful muscle, myoglobinuria. This disease is also known as paralytic myoglobinuria, exertional rhabdomyolysis, tying up, chronic intermittent rhabdomyolysis, Monday morning sickness. Coming to next slide, etiology. The exact reasons for causation of the disease is not known. However, there are some factors that may involve in the occurrence of the disease. These factors are carbohydrate overloading, local hypoxia, thiamine deficiency, vitamin E deficiency and selenium deficiency, hormonal disturbances, and electrolyte imbalance. Now, I am going to discuss about the first factor, that is carbohydrate overloading. The major cause of carbohydrate overloading is feeding the draught horses on full working ration during their resting period at weekend and after several days when the horses returns to work, it suffers an attack of this disease. During the rest period, muscle glycogen get accumulated, and when these glycogens are used during exercise, it produces lactic acid in a higher rate, leading to lactic acid accumulation in muscle. This accumulated lactic acid causes local tissue damage and constriction of the blood vessels, which may result in decreased blood flow to the tissues and further reduces lactic acid removal. Lactic acid also causes swelling and hardening of the muscle, and the muscle become hardboard-like. Coming to second factor, local hypoxia. There are certain types of muscle fibers which are larger and have greater glycogen stores and fewer surrounding blood vessels than other fibers. When there is local hypoxia, that is lack of oxygen supplied by the blood, it causes increase in the lactic acid production in these fibers, causing stiffening of muscle. Coming to third factor, that is thiamine deficiency. The vitamin B1 thiamine is involved in the metabolism of waste products from muscle activity. Therefore, a deficiency of this vitamin can lead to a buildup of these waste products and hence resulting in lactic acidosis. Coming to next slide, the fourth factor is vitamin E and selenium deficiency. A deficiency of these two compounds may also cause azoturia, and this theory is based on reports of success that further episodes of the disease is prevented following supplementation of these two compounds. Now, the fifth factor is hormonal disturbances. Disturbance in the reproductive hormones, thyroid hormones, cortisol may also cause azoturia. And the last factor is electrolyte imbalance. Chronic sodium and potassium deficiencies may be involved in occurrence of chronic equine rhabdomyolysis. Now, epidemiology of azoturia. This disease is in worldwide distribution. It occurs commonly in thoroughbred race horses and endurance horses. It is usually observed during or immediately after exercise. Some cases do occur after short period of rest following exercise. Female race horses of 2 to 5 years of age are more susceptible. Case fatality rates are high in severe cases. Coming to pathogenesis. When the draught horses are fed with highly concentrated ration at resting period, it results in formation of large stores of glycogen in muscle. And when these horses returns to work after several days of rest, during their exercise, this glycogen is converted to energy and cause accumulation of lactic acid. The rate of removal of lactic acid from bloodstream does not equal to its production, and thus the disease occurs. Another pathogenesis is when the horses are fed on ration deficient in vitamins like vitamin A, B complex, C and E, and minerals like calcium, phosphorus, sodium, copper, magnesium, manganese, iron, cobalt and iodine. This leads to disturbance in metabolic processes, improper functioning of the body, and dystrophic changes in central nervous system and peripheral nervous system, endocrine glands and skeletal muscles. This lowers the resistance of the animal body that leads to streptococcal sepsis or septic shock, which results in tissue hypoxia, and due to tissue hypoxia, there is increased production of lactic acid in muscles. Then, this causes coagulative necrosis of the muscle, which is followed by liberation of its myoglobin and its secretion in urine. The lesion may affect the sciatic and other crural nerves, and there may be secondary neuropathic degeneration of the rectus femoris muscle. Now, clinical findings of azoturia. According to amount of exercise and extent of muscle damage, clinical signs may vary. In very mild cases that receive little amount of exercise, there only poor performance is observed. In mild cases, stiffness of gait are observed. In severe cases which receives excessive exercise, there may be profuse sweating. The horse may assume a dog-sitting position, which is followed by lateral recumbency, laying down, and repeated attempts to rise. There may be accelerated weak pulse, rapid respiration, and temperature may rise up to 40.5 degrees Celsius. The muscle become hardboard-like, particularly the muscles of hind legs, for example gluteal and quadriceps femoris muscle. The horse voided dark red-brown urine. This is the picture showing excretion of dark red-brown urine by azoturia affected horse. This is another picture showing dog sitting posture of horse. This is the picture showing profuse sweating of horse. Now, how to diagnose azoturia? Azoturia can be diagnosed by taking proper history, by observing the clinical signs that I have already explained in the previous slides, by laboratory diagnosis like urine analysis, which is done for detection of myoglobin pigments in urine, blood examination. This is done for detection of increased serum myoglobin levels, increased activity of enzymes like serum creatinine kinase enzyme, aspartate aminotransferase enzyme, and lactic dehydrogenase enzyme. From blood examination, decrease in serum sodium values and increase in serum potassium values are also noticed. Coming to treatment. Azoturia can be treated by following some general hygienic aids like further exercise of the animal should be immediately stopped, animal should be rested in standing posture, the affected limbs should be massaged with hot fomentation, increase feeding of green fodders, administration of 1 liter of 1% sodium bicarbonate intravenously may be useful against blood acidosis and alkalization of urine. Intravenous injection of large quantities of fluids and electrolytes is useful for maintenance of high rate of urine flow to avoid renal tubule blockage and subsequent uremia. Now, medicinal treatment of azoturia. Azoturia can be treated by administration of analgesics like phenylbutazone at the rate of 2.2 to 4.4 mg per kg body weight intravenously, or ketoprofen at the rate of 2.2 mg per kg body weight intravenously at every 12 to 24 hours, by parenteral infusion of Ringer's lactate, administration of urine alkalizers, for example sodium bicarbonate 1.3% solution intravenously or 50 to 100 gram orally, by using mild sedatives like xylazine at the rate of 0.1 mg per kg body weight intramuscularly, by administering thiamine at the rate of 50 mg per kg body weight intramuscularly, and by administration of antihistaminics. Now coming to next slide, prevention and control. Azoturia can be prevented by providing a balanced ration and a schedule of consistent regular exercise to the workhorses. The horses which are on rest should not be given full working ration. Sudden exercise after a period of rest must be avoided. And lastly, thank you everyone for listening to my presentation, and I hope you liked the video. Thank you.